Now like to welcome Dr. John-Paul Sanggaran, who is a doctor trained at Griffith University in Queensland, who worked on Christmas Island, and he was one of the signatories on the open letter, which was published in The Guardian, and he's currently doing his general practice registrar in Brisbane. Thank you.
Sorry. Good evening. I apologise for largely reading this speech, but I need to be careful with my words. I worked as a medical officer on Christmas Island within the immigration detention centres. This was shortly after the implementation of the rapid processing policy. This period was described as high intensity by International Health and Medical Services, the private entity contracted to run health services throughout the Australian detention centre network. Whilst there, I developed concerns over both the human rights of detainees and the medical care provided to them. This culminated in the writing of an extensive document which took pains to pin concerns to evidence and patient examples. This document found its way into the media and was published in a redacted form through The Guardian. IHMS named me as the principal author of the document. I wish to take this opportunity to speak as an opportunity to address the content of the document and the reaction to it. A useful way to understand my concerns is to attempt to put yourself in the shoes of an asylum seeker being brought to Christmas Island. A typical new arrival has been on a rickety boat for a few days to several weeks, often exposed to the sun, wind and rain. There is no access to sanitation or toilet facilities. The boats are cramped, dirty and too frequently with insufficient food and water. The Australian Navy finds you and after varying lengths of time brings you ashore onto an island in the Indian Ocean. Without ensuring all your basic needs are met, as defined by the Australian Human Rights Commission, including a shower, a change of clothes, adequate sleep, food and water, you are herded into the shed to be processed. In this condition, where your ability to consent to medical care is questionable at best, you are sat around and through group translation, using documents you likely cannot read, you are put through an extended induction. During this process, you are separated from your belongings. Critical for medical care, this includes your health information, such as specialist letters and medical records. There might be ultrasound reports from your current pregnancy. All of this information will be difficult to retrieve and is almost invariably lost to you and the doctors attempting to care for your health. Your medications, many of which will not be available on the island for perhaps weeks, are parted from you. These medications were in fact being destroyed by a couple of nurses popping pills into a rubbish bin with no records being kept of what medications were being destroyed or who they belonged to. You might have medical aids that you can no longer access. This included glasses, hearing aids, and parts of a prosthetic leg. I never saw a replacement for any of these. I don't know anyone that had. You then sit around through multiple assessments with the AFP, customs, mental health. There are blood tests and several vaccinations. One part of this is a medical assessment. Braggingly, one doctor recounted that he had done 90 in an 8-hour shift. The supposed purpose of this assessment is to collect your entire health history to ensure suitability for placement within an immigration detention centre and to pick out those requiring urgent detention, as well as to find those that will be too risky to send to offshore processing. The volume required to be processed in the time available is medically dangerous. As predicted by peak bodies such as the Royal Australian College of Physicians, these assessments are completely unreliable and errors occur. There are gross abnormalities which are not picked up. Unfortunately, due to confidentiality, I am unable to give examples. This process is supposed to be carried out according to guidelines put down by the Department of Immigration itself. It should include specific laboratory tests and specialist review where indicated. these failed to occur. The implementation of rapid processing over time meant the rigour of the assessment was cut back piece by piece until the few bloods that are taken are not returned in time to be reviewed before sending detainees offshore centres such as Madison Nauru. Conditions and symptoms which would have prevented you from being transferred no longer applied, and a tolerance for more medically risky transfers was adopted. One might ask, as several did, why bloods were taken at all if the results were not to be reviewed before transfer. This haste led to incidences such as pregnant women being administered contraindicated vaccines. IHMS admitted through their management to their staff that the reason for rapidly processing new arrivals was a political imperative. This while also acknowledging that their care delivered is below the contracted aim of Australian healthcare equivalence. In preparation for transfer, detainees are mass prescribed Malarone for malaria prophylaxis without individual consultation. The norms and standards of medical practice are so distorted within this environment that mass prescription, without discussing the purpose of the drug, is something that I got halfway through myself before waking up to the fact that it was both unethical and dangerous. It wasn't even clear that the detainees were to receive an explanation of what the medication was for. Whilst things certainly worsened during rapid processing from July to September, the problems did not start then. There is evidence of similar complaints having been made over years. These complaints obviously did not result in effective positive change to the system. If you are not to be transferred offshore and are to be detained on Christmas Island, then you have many healthcare challenges ahead. You will experience multiple requests to see a health professional. Detainees frequently complain that they'd been trying to see a doctor for weeks and months. Once you get an opportunity to see a doctor, you'll be summoned by your boat number, as I note many people here have commented on, not your name. It's a thoroughly dehumanising practice. The healthcare staff looking after you will be using a universally recognised substandard health informatics system that routinely loses information critical to your care. The effects of this cannot be overstressed, resulting in prescribing errors, medication dispensing errors, and poor management of critical results. During a period of high arrivals, doctors that would otherwise have been rostered to clinics within the camp had their time consumed with clinically worthless health assessments. It was reflected back to staff that the government was not willing to pay for more doctors to deal with the capacity constraints, and IHMS would not pay for overtime. As a result, the clinics shut down and you could simply not be seen. One doctor expressed the situation by recounting his experience of walking into Lilac Camp. The doctor was confronted with women crying out and coming forth, carrying sick, floppy infants, pleading for medical treatment. The private company IHMS is aware of these issues and has been aware of them for an extended period in the order of years. If you're a child held on Christmas Island, despite a clear duty of care, your health service provider does not effectively advocate on your behalf. It is quite clear that there are serious long-term negative health effects to holding children in detention. The Royal Australian College of Physicians calls for an immediate end to the practice of detaining children. Despite this, IHMS enables their detention by nominally providing a healthcare service. There is inadequate screening for nutritional deficiencies, inadequate testing of sight and hearing, no monitoring of growth and development, none of the routine physical and developmental assessments that would normally occur take place. There is no child-specific mental health service on the island. Additionally, they are receiving only an excuse of an education, sharing on a rotating basis limited places in a local school. We are not doing so much as looking for the problems that we know will arise. This in a population of children that have been exposed to war, loss of family, cultural dislocation, and numerous other serious trauma, including physical abuse and worse. During your detention, if you had a serious medical issue that Christmas Island was unable to deal with, then you face unacceptable and dangerous delays in your care. The concentration of resources on rapid processing led to a backlog of patients requiring transfer. In fact, a backlog on the awareness of patients that required transfer. This is in the context of planes being chartered to Madison Nauru with great frequency. The urgency with which some of these patients needed specialist and often surgical care cannot be emphasised enough. Tragically, it was often due to the conditions of detention that their urgent medical need had arisen in the first place. There are cases of people whom, because of their detention, suffered conditions which put them in a potentially life-threatening situation. They will probably suffer lifelong complications as a result. These patients were frequently advocated for by medical officers, but efforts were stifled due to a contrived limitation on the capacity of transfer places, postponement by faceless individuals within the department who had never actually reviewed the patient. We were told that the Department of Immigration was accepting the risk for delaying transfers. I cannot accept that a governmental department can absolve me of my professional responsibility to my patients. It cannot remove my duty of care. There are some individuals which from their day of arrival were clearly not suitable for the immigration detention setting. They were flagged as such, often repeatedly and forcefully by doctors coming into contact with them. An unfortunate example of this are the disabled, whom cannot be cared for on Christmas Island due to the non-existence of appropriate medical devices and staff. If people were aware of the situation that individuals with disabilities and their family members face in attempting to care for them, I cannot believe there would not be widespread outrage. If you are a pregnant woman, then you do not have access to the basic standards of antenatal care. Even the Christmas Island Doctor's Handbook is clear about patients receiving standard antenatal care. The guidelines set out by RANZCOG make no bones about the fact that the remoteness of a woman does not impact on her right to good quality antenatal care. This is, of course, ignoring that this is a contrived remoteness in the first place. The lack of access to ultrasound meant there were no dating scans, there was poor access to morphology scans, even in the event of potential iatrogenic harm through the mistakes from rapid processing. If you found yourself in a position where you were seeking a termination, the wait meant you could progress to a point where it was no longer feasible. If you had a threatened miscarriage, irrespective of the gestation, there is no access to appropriate obstetric services. The difficulty with transfers meant that you may not see an appropriate specialist within a reasonable time or indeed at all. Perhaps more alarmingly, you might be singled out as an example, a form of deterrence to others, to send a message that irrespective of your condition and the inherent risks to your health and that of your unborn child, you will still be sent to offshore processing. A case in point is the well-publicised issues around an asylum seeker thought to be carrying twins that the media has dubbed Latifah. This woman was thought to be carrying twins by medical staff on Christmas Island, but it was unable to be confirmed due to the lack of obstetric ultrasound. It gives the impression of ignorance to the point of incompetence, or that of dishonesty, that the minister would berate and chastise reporters, saying, "I strongly suggest that media should more thoroughly interrogate the sorts of claims that are being represented to you." This as a response, denying that a woman carrying twins had been sent to Nauru. This after his practice of minimising transparency. As far as we knew, she was pregnant with twins when she was sent. Medical staff that expressed concern were given assurances that Nauru could handle it. We would have known that she was carrying a singleton pregnancy if basic standards of antenatal care had been met. There is much more that was contained in the document, ranging to accreditation of facilities, concerns about breaches of the Australian Practitioner Health Code of Conduct. The President of the Australian Human Rights Commission, Gillian Triggs, when commenting on the document, and I'm pleased you're here with us, said, "The 15 medical practitioners make a powerful and credible statement that shouldn't be ignored. Sadly, Professor Triggs, I feel our work has largely been ignored. These concerns have, at least in part, have been repeatedly expressed by those who have been involved before us. This is despite repeated promises to address the issue. Despite 18,000 words of detailed concerns, there has been no adequate response. There is a single page we have received from IHMS, and I got to see a demo of their new IT system. I in fact fear repercussions because I have spoken out. It is those same fears born of confidentiality clauses in contracts and the culture of secrecy that serves to silence, that prevents good people from raising their voices. There are many individuals for which I have ongoing concern. I do not know how they have progressed. Unfortunately, due to my experience working in that system, I do not have confidence that they somehow now receive appropriate care. There are still children in detention, a situation that I, as a doctor and a father, cannot accept. Neither does the UNHCR or peak Australian medical bodies. We have the capacity to provide adequate care to this vulnerable population. and all of us have the ethical responsibility to do so. To continue in this manner is a disgrace and shameful to all of us who call themselves Australian. I thank you for your time, ladies and gentlemen.